Maddie was born December 27th, 2009, and she was born a preemie by about 9 weeks. She was only 3.5 pounds when she was born. Because she was a preemie, they told us that all of her gross motor skills would be delayed, and maybe by the time she was 2, she would start catching up with her peers. By the time Maddie was 2, she still was not crawling. We ended up, when she was about 2.5, going to Shriners Hospital in Chicago, and one of the things that Maddie had was she has tremors, and after we told the doctor about her tremors, one of the first things he said to us was he wanted to test her for a disease called SMA. SMA stands for spinal muscular atrophy, and the test results came back positive. At the time, Maddie was still barely crawling, not walking, not bearing any weight. The day of the phone call, I'll never forget, my husband and I were sitting at home, and the doctor called and asked us to go somewhere private and to sit down. And he explained that Maddie had a disease called spinal muscular atrophy, and it was a very serious disease. It was actually a fatal disease that would kill my daughter one day. He told us that she would lose the crawl that she had, and she would never walk, and that our daughter would be in a wheelchair for the rest of her life. He told us that she would probably die by the time she was in her teens. He reiterated to us many times that this was a very serious, fatal disease, that there was no cure and there was no treatment for this disease. Basically, SMA is a degenerative disease very similar to ALS, and it is deteriorating her muscles. She is missing a gene called your SMN1 gene, and it is the only gene in your entire body that has a backup gene. You have a backup gene called your SMN2, and the SMN2 produces a small amount of protein that the SMN1 actually produces. So the SMN1 feeds your muscles and makes your muscles grow. She has 0 copies of an SMN1. Her body does make a very little amount, and that is what they are using right now for breakthrough therapies. There is currently a trial that has gone into phase 3 clinical trials. It's the last stage before FDA approval. This drug is called SMNRX. It's the first drug that was developed to treat the underlying cause of SMA and to advance to late-stage clinical trials. Cure SMA was actually one of the original funders of this organization, of this research, and it is showing very promising effects on SMA kids. After it's through phase 3 of FDA trials, it would be open to the general SMA population, which is what we're hoping for. Maddie did not qualify for any of the trials, so she currently isn't receiving any drugs, any medicine. The money that we're raising is going to this organization, Cure SMA, and hopefully we'll be getting these drugs, and that something will be approved to stop the deterioration of her muscles, because as of right now, her muscles are atrophying. They're dying as she sits there. So if a cure or a treatment were to come next year, in 2 years, in 3 years, hopefully it would stop where she's at and stop the atrophy from continuing. Hopefully it would also build her muscles and bring back some of the muscles that are dormant, or anything that's atrophied already, that we can build on that and build new muscle. We will be hosting our very first annual Evening of Hope Gala in honor of Miracle for Maddie. The event will take place on Friday, February 19th, 2016 at 6 p.m. The event is going to be at St. Ambrose University at the Rogalski Center. All proceeds will be going to Cure SMA organization in hopes for a cure for spinal muscular atrophy and in support of families.